Hello, everyone, and thank you for joining us. My name is Jennifer Larson, and I am the training coordinator for the Office of Community Living. We'll just go through a few housekeeping reminders. We are recording today's meeting, and we will be using the Q&A panel to manage questions. So please click the Q&A button at the bottom of your screen to type those in as you have them. The chat will only be used to share links with you. We will not be responding to any questions there. We are going to put a link to today's slides in the chat for you that you can click and view and download those. We are undergoing some maintenance on our website right now, so we won't be able to post those on our website until next week. And Zoom does provide closed captioning. If you click on the CC button at the bottom of your screen, you can either turn that on or off. And I will turn it over to Haley to start us off. Haley, are you ready to go? Just waiting.
Oh, sorry about that. It wouldn't let me unmute. So here I am. Thank you so much, Jen. If you can go to the next slide. All right, welcome everybody. It's great to have you for our quarterly American Rescue Plan Act update webinar. We have a lot to go through as usual today. If you go to the next slide, Jen, I will get through our agenda. So for those that I haven't met, my name is Haley Gleason. I am the Strategic Outcomes Division Director within the Office of Community Living, and I have the pleasure of facilitating the webinar today. The majority of our webinar today will be taken up by an equity report out. So one of our ARPA projects has been focusing on looking at the disparities that exist in our home and community-based services system. And we are so excited to have Teja Sin, who is one of our staff members within the Office of Community Living, and Jack Becker from Civic Consulting Collaborative here to present the findings from the initial phase of this work. Really interesting outcomes from this, and they've learned a lot. So we're excited to share that with our stakeholder community today. After that, we have another couple of projects that we wanted to highlight, some really exciting things coming out of our projects. You know, for a long time, we were in the planning phase and we were talking to you about what was coming. And now we get to talk about all of these incredible outcomes that are coming out of this work. So a couple of staff members will be here to talk about their projects and share with you some of those projects. And most of them are not even complete, just sort of the activities that have been completed to date and some things that I think you'll find really useful in your own work. And then we're going to move on to talking about grant opportunities. So we still have several grant opportunities that are available for either providers, members, or community-based organizations. We want to be sure that you know about those and would love your help in sharing those with your network. Those grant opportunities are slowing down a little bit as we're moving towards the end of ARPA. So we want to be sure that we're getting the word out about these last opportunities as they come available. And then we will wrap up with a little bit of what is to come and next steps and give you the save the date for our next webinar. Next slide. All right, and before we jump into project-specific information, I wanted to provide a little bit of a general update on where we are in implementation of all of this really important work. Next slide. So as many of you are aware, we are required to report on a quarterly basis to both the Joint Budget Committee here in Colorado and to the Center for Medicare and Medicaid Services. Our most recent reports can be found here We'll have the links put in the chat, but they're also available on our ARPA HCBS website. Those may be a bit daunting. They're quite long, but they have a ton of information about each of the individual projects, updates on what's been happening over the last quarter, including our spending, and just general any changes that may have come about from within the project. So they're a wealth of information. So I really do encourage you to take a look at those. Again, we always post them on our website. You can go back and look at all of the previous quarterly reports, but these are our most recent, just submitted on November 1st and October 18th. Next slide. All right, so we love to put this slide up because it gives a very high level overview of some of our key indicators in terms of progress related to these projects. So as a reminder, we've got 63 separate initiatives that are underway under ARPA HCBS. 25 of those we're calling grants, pilots, or community initiatives. So those are really projects that are focused on getting funds out into the community. And through those, we're spending about $140 million. And we're pretty excited to share that we now have almost 700 executed grant agreements through these different projects. So tons happening in this space. And we can't wait to continue to update you on all of those really exciting grant programs. We have less than 13 months to spend. So for us, we're in a bit of the countdown phase here, moving towards really starting to look at closing a lot of these projects over the next year. We continue to do quite a bit of stakeholder engagement, including these webinars, but also at the project level, there are work groups and webinars, surveys going out, all sorts of different engagement mechanisms happening to gather feedback from stakeholders. So across all of that work, we've engaged over 9,300 stakeholders since we began this work. And our ARPA HCBS website continues to be sort of the source for information for people. And you can see that through almost over 80,000 people have visited that website. So we continue to utilize that as a primary way to communicate out information about ARPA generally and about our projects. So please do continue to visit that in between these webinars so that you can stay informed. Again, as a reminder, we have $552 million that we are working to spend over the course of this time period. And of that $552 million, over 90% are is directly benefiting the community. So funds that we are again pushing out to our providers, to members, to community-based organizations to really strengthen our home and community-based services system. Next slide, Jen. So what's happening with all of that money? We wanted to provide you an update through October of what we have spent to date. So as a reminder, that budget is $552 million. Through October, we have spent $263 million of those dollars. We have just under half of that left to go. Although we already do have $112 million encumbered, meaning of those remaining funds, 112 are already obligated through contracts or through grant agreements. So we know that at least 112, and that number is growing every day as we continue to get these grant agreements executed and contracts in place, that 112 million of that is already sort of obligated and will be spent over the course of this fiscal year. So this is through those encumbrances are through the end of June 2024. So still quite a bit of money to get out the door, but as you can tell, we have a lot of that already planned for and will be, pushed out to our providers and community-based organizations over the coming months. Next slide. All right, well, I'm excited to pass it over to Tasia Sin, who is going to share a little bit about the outcomes of one of our ARPA projects. Are you having trouble unmute? Oh, there you go.
There we go. I was like, I'm having the same problem. I don't know how to elevate it. Hi, everyone. Thank you for letting us come and present this information. We're really excited. My name is Tasia Sin. I work with Haley in the Office of Community Living and our Strategic Outcomes Division. And my job is really around a lot around stakeholder engagement and communications and kind of the strategy behind that. And part of my work has been leading some of this equity work. And so we'll talk a little bit about the specific project I've been leading, and then a little bit more about where some of this work has gone. Before I go on, I want to invite Jack Becker, who has been an excellent partner with him and his team on this work, to introduce himself quickly, and then I'll kind of go into the work, and then he'll present the second half. So Jack, are you able to unmute
Hi.
yourself? Yeah, okay, good.
Hi, everyone. I'm Jack Becker. I identify as a white heterosexual male in my mid-30s with short brown curly hair, facial hair, brown eyes, and wide-rimmed glasses. And I'm excited to join you, Tasia, in the project. I'll talk a little bit more about the Civic Consulting Collaborative, I think, once you pass it to me.
Perfect. Thank you, Jack. Okay, can we go to the next slide, please? Awesome. So the project that kind of kicked all of this off was the 3.01 project, and we called it the Home and Community-Based Services Equity Study. And the goal was really to help us better understand who receives home and community-based services in Colorado, what services they receive, where there are gaps, and kind of try to understand how to better target outreach to ensure that there is more equitable representation in our programs. And so on this slide, I like to identify the sort of three phases and then why this is important, and the why isn't typed out. But the three phases of the work were really internal data analysis and literature review. So that was part of understanding what the current landscape in our programs looks like. And then we did external feedback and recommendations. And so that's where we partner with Jack and his team, and he'll go through our findings there. And then some implementation planning based on what we have found through this work. And so we're in that planning phase, but actually have launched a lot of the findings already. And so I'll talk a little bit about that. And just to note sort of why this work is important. So everyone on this call, probably most of us, often think of disability as a primary lens for looking at equity. But there's also really important impacts for folks within the disability community that are experiencing other that are part of intersectional identities. And those identities can be, like age, race, ethnicity, different co-occurring health conditions, geography where someone lives. And so we really wanted to understand how these intersectional identities are playing out in our programs, because we know that they can have really impact on people's lives. And so while we often use disability as a primary lens, we are actually digging a little bit deeper and going one layer and looking at other identities that folks who have disabilities may also be identifying with. Sorry, I was looking at my next slide. Jen, can you go to the next slide? So this graphic, so when we thought about this project, we were like, well, what does disability sort of look like in Colorado? We're able to kind of look at our programs and see who's enrolled, but what does it look like across the state? And so this slide shows disability prevalence in Colorado. And we took this data from the US Census, and it asks respondents to self-report in 6 different categories. And this graphic shows the people who responded in at least one or more of those categories in 3 different age groups. So we're looking at, as we would expect as folks age, they're reporting more disability. But within the age groups, what we notice is there is some impact of race, ethnicity on the self-reporting of disability prevalence. So when we looked at this, we said, okay, we might expect to see, higher representation in our programs for Black and American Indian and Alaskan Native members in particular, and then also in older adults, Native Hawaiian and other Pacific Islanders, and Hispanic Latino as well. As you can see, it's kind of hard to decipher this graph quickly in a slideshow, but white individuals tend to have less prevalence across all the age groups. So really this tells us that people with disabilities are in all communities. And so when we think about how we get, how we are analyzing our HCBS, we would expect to see sort of this kind of representation. But as some of us might guess, next slide, Jen, when we actually looked at enrollment in programs, we see, so this is for children, this chart's for children, 0 to 17, and we see that kids enrolled in HCBS are predominantly white, and especially underrepresented are American Indian and Alaskan Native children, Black children, and Hispanic and Latino children. We chose to compare home and community-based services to Medicaid overall to really try to capture sort of who might be eligible, what that eligible population would be, and try to get that comparison. So more of the sort of lower income that is enrolled in Medicaid and then would also have this disability and qualify for HCBS. So we're already seeing underrepresentation in children, and then the next slide is adults. And we see similarly, next slide, thank you, that white is the predominant race that we see again in our programs compared to Medicaid overall. And then especially underrepresented are the American Indian and Alaskan Native communities, and then Hispanic and Latino as well. Really quickly, I'm going to go through some key findings. All of these data, so next slide, Jen, all of these data are, we just published our report on our website. And so there's several links throughout this presentation, and maybe Max can pull that for me and put it in the chat. But really fast, I'm going to run through these. Finding number 1, Hispanic Latino members are underrepresented across all age groups, and especially children and youth. Finding 2, Spanish speakers are underrepresented in HCBS across all age groups. Finding number 3, white members are more represented in certain waivers and services, and particularly the adult developmental disabilities waiver and the community mental health supports waiver for adults. And then we also see children and youth who are white are more represented in the community, the Children's Home and Community-Based Services waiver. So we see some variation on waiver as well. Next slide. So for smaller racial and ethnic groups in Colorado, those that have smaller population sizes, there are concerns that there are underrepresentation in any HCBS service, and we're particularly worried about children and Alaskan Indian American AIAN members. And then finding 5, across most geographic regions of the state, white members are more represented in HCBS when compared to Medicaid overall. So we're seeing this finding across the state. And then finding 6, HCBS members are more likely than Medicaid members overall to have behavioral health condition. 41.6% of Medicaid members have a behavioral health diagnosis, while 70% of HCBS members have a behavioral health diagnosis. So that's a pretty big disparity, and something, you know, that we probably know as a community, but something for us to keep an eye on. Next slide, Jen. So when we took all of the data and we sort of said, okay, let's think about a logic model about how do we identify these compounding disparities? So in order of the outermost ring, that's prevalence. That's that first data slide I showed. So already we're seeing disparities show up just in the prevalence of disability. And then when we go into the inner rings, we're looking at enrollment in just HCBS in general, enrollment by waiver, and then authorized hours that folks are getting for services, and utilized hours that folks are getting for services, and then the most inner is outcome. And so if you think like the people are already experiencing disparities in the outer rings, once you get to those inner rings, they're really compounding. What we decided to do was really focus on this enrollment piece. That was the first place we saw disparities. They're pretty distinct disparities. And so we outlined our stakeholder engagement sort of around this enrollment piece. And so with that, I think I'll turn it over to Jack now to talk a little bit about what we did to kind of learn more about that piece. Jack?
Thank you. Thanks, Jen. You can go to the next slide. So again, my name is Jack Becker. I'm with the Civic Consulting Collaborative. We are a unique member-owned cooperative, and our consultants help navigate challenging health, social, and environmental issues by ensuring community is at the center of systems change. We also were joined by our partner, CREA Results. They're not here today, but they were an active member of the project, and they have for a very long time worked in Colorado within health equity through their renowned Promotores de Salud community health worker model of work. So this project, for the most part, ran from January through June. We engaged hundreds of Coloradans through a survey, through OCL's email listserv, 2 virtual statewide summits, and then the big portion of our work were 9 learning exchanges with community-driven organizations. And so I'm going to focus the report out here really on those learning exchanges, what we learned from those, and the results. Thank you, Jen. So again, our project starts on the premise that we all have complex entities. However, if your cultural community isn't connected to formal systems, then you likely have an even lesser chance of knowing about a critical program or knowing how to navigate its complexity. And so this is really where we see trusted community-driven organizations come into play. They hold social capital in their communities, and they act as a critical bridge and broker for their community systems from systems that have traditionally excluded them or marginalized them, either explicitly or implicitly. These organizations and their navigators are expert, we found, in their communities' cultures, histories, needs, and opportunities, while also having expert language and understanding of how to navigate systems like Medicaid and how those systems operate. Next slide, please. So I had said learning exchange. What is a learning exchange? Maybe a little bit of our jargon, but really what we mean here is we engaged community-driven organizations that are of, by, and thrust forward into the world by people in their communities in these 2-hour co-designed conversations that facilitated a 2-way dialogue. We really entered into these conversations understanding that everybody was bringing their own expertise and their own experiences, and we really wanted to ensure that it was a 2-way conversation and a 2-way street. And so for us as the Civic Consulting Collaborative, we really tried to act as our own brokers in setting up these conversations, having conversations with organizations to sort of see what the readiness is, find times that work well for them, see how we can change the agenda or make things responsive, but then similarly do so with Tasia and her team and ensure that we are all coming together sort of on an equal playing field. And we really sought to create a space where real world perspectives and talking about those unique cultural and linguistic nuances was as valued a part of the conversation and as centered a part of the conversation as giving them the download on HCBS, as talking about what is the impact in your community. And so we really sought for this to not be an extractive learning focus group type thing, and really have it be a partnership and building towards relationships. Thank you. These are some of those amazing organizations. They were in various places throughout the state. Just a few words about these folks. These are folks that spoke deeply from their experience and hold deeply trust in their community and relationships in their community. Many of them were peers, meaning they were really of their community. They had the same experiences. We spoke with an organization that works directly with populations who have HIV and AIDS, and they themselves may be living with HIV and AIDS, or immigrants in a organization that are set up to help immigrants navigate life in Colorado and navigate access to systems. And so these folks' perspective into how HCBS can have greater awareness and enrollment was nuanced, and we'll talk a little bit more next about what we learned from them. Thank you. So community resource navigation work is highly contextualized and nuanced. It has to respond to a mix of factors: cultural, regional, economic, linguistic, and logistical. And these organizations describe themselves as, quote unquote, the place where people show up with lots of questions because they feel comfortable to express their needs and concerns. These organizations specialize in warm or hot handoffs to support their communities in re-engaging in systems and services that they themselves may have mistrust or have experienced harm in. And so what we see here describes some of the key themes highlighted and that we learned and were shared with us from the learning exchanges of how organizations navigate complex barriers and champion health equity every day with the people that they work with. A couple other things that were shared with us. Someone in one of our conversations said, you know, we help families feel the pain and tell families to trust in me. For families and for us, it's exhausting because people do the same thing over and over again. Things disappear and it makes it so difficult. Speaking to how they sometimes just are the one to share the burden so that they can help that person walk and complete the steps that they need to. Another person shared with us, we have tangible relationships with people, with clients and other organizations, so that I can connect them and be the bridge through the trust I've established. Sometimes that includes walking alongside people and supporting them, going to appointments, making phone calls, following up with an organization. So the ways that we heard agencies and individuals at those agencies understand the people in their communities and then find creative ways to navigate towards success was sort of just again and again. Thank you, Jen. Okay, so I'll sort of detail in brief the 4 kind of big buckets of recommendations. And again, these are really what we heard through our full set of engagement. These are the strategies, the ideas, and the solutions that stakeholders provided us directly with, and we did our best to maintain their words and language and put that down for Tasia and her team to run with, which they are doing. Next slide. A focus on trust and relationships is critical in driving toward greater awareness. HCPUF and the Office of Community Living have done much to elevate the importance of relationships and trust, including hiring from those with learned and lived experiences and those who have worked at the local and county levels. And we heard that this commitment can be further elevated through these 4 critical avenues that can be expanded specifically to focus on including more community-driven organizations, including as an information provider. HCBS has a fabulous opportunity to highlight community-driven organizations through their email listservs, social media, and other avenues to raise awareness about their work throughout the system. As a convener, HCBS continually brings people together for conference, panels, public meetings, webinars such as this one, to develop constructive two-way awareness about their work, two-way conversations and examine topics. These opportunities can be expanded to highlight the critical role community-driven organizations play in driving toward greater health equity in communities statewide. As a facilitator of relationships, HCBS often makes warm handoffs themselves, and they provide many direct contacts for members, providers, as well as community-driven organizations. We heard from organizations that this is a significant value add for them when they get it, and it's often something that they're seeking more of. It helps them with complex navigation needs. And so this is an area that we definitely heard they would love HCBS to continue to focus on. How do they make warm handoffs, and how do they ensure that that's available to everyone? As a capacity builder, HCBS may consider bringing directly together community-driven organizations with agencies and counties to directly develop those relationships and conduct some of that shared learning, such as through workshops and learning exchanges themselves as well. So lots of opportunities we heard. Thank you. Driving toward greater equity in HCBS enrollment and utilization also requires increased awareness and dissemination of information about HCBS in more communities throughout the state, particularly in communities of color. HCBS can examine opportunities for more integration in statewide training programs. Some community-driven organizations, for example, reported having currently or previously been certified application assistance sites or enrollment or medication assistance sites and other designations through the state or county. But they also reported that HCBS did not show up strongly or at all through the training and certification process. And so that's an opportunity to really infuse that into the experience. Increasing awareness for state employees working on health-related topics is also an important avenue. At any given time, we know that there are dozens and dozens of health-related campaigns seeking to reach communities throughout the state, often seeking to reach the exact same communities. And there are many state employees that interface with community members and organizations that, if empowered and had this information, could also play a very critical role in ensuring more people are aware of not only just HCBS in general, but specific pieces of material that can really move the needle on enrollment. Disseminating HCBS materials, sorry, you can go back one slide. Disseminating HCBS materials by partnering with community-driven organizations to promote materials and integrate into their normal operations can also be a significant way to increase awareness and enrollment. So I think the critical avenue there would be having resources available to do some of that dissemination, especially for under-resourced organizations. And then finally, utilizing legislative instruments such as the new community health worker legislation to embed HCBS into the system. I think we still see that some of that new legislation and rulemaking is likely going to play out, but it's anticipated that there will be an expansion of community health workers that are going to get hired and trained across the healthcare system. That is potentially a golden opportunity to infuse HCBS potentially into the rulemaking and procedural process in terms of information that needs to be learned or shared. Thank you. Next slide. Across all our stakeholder engagement, we heard a need for updated materials to support direct outreach to current and potentially eligible members. There's a significant volume of this work that was already ongoing and continues to be ongoing. But in general, I'd say we heard the importance of developing materials that are simple, affirming, and actionable, that tell people and sort of empower them on what to do, what the next step is. And across our conversations, financial eligibility was a top concern and point of interest. And in particular, there was significant interest in having more materials that really explain and help guide around buy-in programs and ABLE accounts, and more examples that really help understand the exact numbers of financial eligibility and not just percentages or generic thresholds. One more slide, I believe, for me, Jen. Thank you. Accountability and support systems must ensure that navigating towards successful HCBS enrollment is not dependent just on the individual one encounters within the system, but that the broader system is oriented towards people with disabilities and older adults, their advocates, and community. HCPUF can provide transparency by continuing to evaluate enrollment and utilization data regularly, to assess progress on equity outcomes, and by analyzing and sharing regional data based on demographics, such as the information that Tasia shared with us today. HCPUF may need to develop additional standards and evaluation protocols for case management agencies to support individuals navigating marginalized situations. This may also include communities of color and populations currently underrepresented in HCBS. Thank you. And I don't know, Tasia, if you were going to pick it up here. I did just want to say, Tasia, the Civic Consulting Collaborative and CREA Results has really enjoyed and appreciated the collaboration with you and the Office of Community Living. And just really want to shout out that we really felt like OCL and your team came to the table in really authentic ways in the community with groups that we met with. And that made all the difference. And these groups have continued to reach out to us and partner with us, as I think you're going to talk a little bit more about, in continued ways. And so I think that's the sign of building a relationship. I think building a relationship is really the meat of what we've been talking about here. That's how difficult things get done. It's how the system gets improved. So really appreciate it. And thank you for inviting me.
Well, thank you, Jack. I think we feel similarly in our work together. And, I didn't say this enough at the front. I just kind of jumped into the work and the tasks and getting it done. But you're right. Like this is about relationships. This is about showing up in ways we haven't shown up before. Like clearly we are not getting across to communities that have been historically marginalized and not involved in these programs. And so this is long-term, very long-term work in terms of that piece, is like really showing up as partners and collaborators. But here I'm going to go through a bunch of other stuff we're going to do beyond just that like deep relationship building piece. So the first thing is extending. We've gotten funding approved for funding to extend this 3.01 project with Civic Consulting Collaborative. So beyond developing an implementation plan, which is sort of the finishing out the first phase of the work, we're going to continue to use the successful model that Jack just went through with the learning exchanges. And we're going to go ahead and work with those certified application assistance sites and use that network that's already sort of a connected network with us to build some more capacity and deeper relationships. And we're going to do a special focus on organizations that serve American Indian and Alaskan Native communities, because that is one area where we feel like we need to focus a little more in understanding sort of what the barriers are, if there's ways to help there. We have another ARPA project that is developing and refining member-facing materials. That's ARPA 3.04 project. And that work, there's been a team that's been developing some materials. We haven't published them yet, but they're pretty cool in terms of explaining all the waivers in plain language, explaining a lot of other programs in plain language. And then, Jack and Amy's the other sort of counterpart that's been working really hard on these projects, is working with a user design group that we mostly formed from our learning exchange work. And that group includes Spanish speakers, and they're really helping us refine these materials to help people better navigate enrollment, to make sure that the barrier is not that they don't know how. So at least breaking down that barrier, which is the first one, and then I'm sure we will encounter another and another and another, but the first one is sort of making sure that folks know what's available to them and know how to get it. We have a third ARPA project under this sort of bucket of work, ARPA 3.05, which is the translation of member materials. So the goal of that project is really making sure that anything that we are sharing out with members to be used in navigating, in accessing and utilizing their services is translated in languages that's meaningful to them. And so we are also, that project kind of took a whole life of its own in actually identifying the materials and then making sure that we have a system in place for ensuring that they're plain language, that they're accessible, and that they're translated. And so we're gonna sort of put that process in place for new materials and then sort of go through the backlog of materials and make sure that those are all sort of up to snuff for folks. And then the last thing is, I think turning a little bit inward and focusing on our team and really making sure that we have a deep understanding of sort of how we are as folks in the world and how other people might be in the world, and really looking deep on those connections. And so we've been just launched EDIA workshops for ARPA staff at HCBS. So we're really excited about sort of deepening that familiarity and knowledge with EDIA concepts sort of with our staff to bolster up this work as we move forward. So those are just some of the things, there's always more, but I just want to say again my appreciation for Jack and all those organizations who've participated thus far, and all of you here. I think being here and wanting to learn about this is awesome. So thank you, and I think we can open it up for questions. I think we were going to have, I don't know if we had any that have come in.
Thank you, Tasia and Jack. Great presentation, such important work. I haven't seen any questions come in yet, but I'd like to invite people now to enter questions into the Q&A box, or you're welcome to raise your hand. You can do so down at the bottom. If you click on reactions, there is a button you can push that says raise hand, then we'll know and we can call on you. If you're on the phone, you can also raise your hand. It's *9 to raise your hand, and then to come off mute is *6. So we'll just wait a minute and see if anybody has any questions or comments. All right, Tasia and Jack, again, thank you so much. And we're excited to continue to get updates from you as the work moves forward. So appreciate you taking the time and sharing today. All right, next slide, please, Jen. Oh, you can keep on going. All right, like I mentioned at the beginning, we have a couple of other project highlights we wanted to spend some time on. We're starting again to see the outcomes of this work, and as that happens, we want to share it with you so that you all know what's being done with this incredible opportunity that we have before us. So next slide. I think first up we have Heather Johnson from our direct care workforce unit. Go ahead, Heather.
Thank you. We are going to watch some videos, but before we do that, I wanted to just provide a little bit of background information about it. So we are launching our public awareness campaign to really highlight the value and the need for the direct care workforce. So the campaign we've called Who is a DCW, who's a direct care worker. We really want to get the word out there about who direct care workers are, what they do, and the impact they have. And so we are doing a campaign in a lot of different ways. What you might see is on your local television, in newsprint. We have it coming out on the radio. So a bunch of different ways, maybe some billboards. So over the next few months, it'll run through February. You will be able to see that. And all of that is going to try to tie folks back into looking at our direct care spotlight site. We have a website we really want to drive people back to. On that site, you can watch the videos in case you've missed them or you want to see them again. They're only 30 seconds. You can find materials that you can use to share, to highlight, to spread the campaign in a way that works for you and your agency, in wherever you're working at. We have social media posts and images that you can use, download it, and go ahead and put out there to kind of highlight that work. Maybe you're doing a hiring event or some sort of community awareness. It's a good way to be able to just kind of use these materials. There are flyers that you can use digitally or you can print. We did make sure some are a little lighter in the ink department. So if you want to print them out, they're not going to take up a whole ink cartridge for that. And we have some different infographics you can use to kind of highlight what direct care work does, because it is across the continuum of care, and also like career pathways within direct care, where you just kind of want to get some information out that might help with recruitment efforts. And so when you go to the site, you'll also be connected to our direct care career site, which is where if you're an HCBS employer, you can post your jobs on that. So it's a good marketing and recruitment tool for you to draw people to that site. They click the link. There's a lot of resources on the site. Eventually, there'll be some training on the site, but it's also a good way to post your jobs and get matches with folks looking to enter the direct care work. And without further ado, I think we could skip to the next slide and start the first video.
So I got into direct care work kind of stumbling in. I had quit my corporate job at the height of the pandemic and I wanted something more fulfilling. I wanted to be able to help support my community in ways that are often overlooked. You develop these relationships, you learn together, you grow together, you laugh together, you share together, you cry together. You really get to see your energy and your time pour into something bigger than yourself. So I got into direct care work.
I didn't choose this job. Life chose me to do the things I do, which I love it because I take care of my daughter. To me, it's a privilege to be with her, helping her every single day in her daily needs. Becoming a direct care worker can be the difference for someone in need, because in the end, it's someone that you love that are waiting for you. I didn't choose this job.
Yo llegué a esta área de trabajo porque me crié con mis abuelos, de crecer con ellos y ver cómo la edad va deteriorando sus capacidades físicas e intelectuales y que necesitan un cuidado especial. He crecido como persona, como ser humano, y esa es la motivación más grande que tengo día con día, de saber que puedo ayudar a que ellos mejoren su vida, ya no de comunidad o de vecinos, sino que tengo muchos abuelitos y abuelitas, y eso es algo que no tiene precio.
And I did want to offer that the materials on the site are in English and Spanish, in all of those materials. So feel free to snag those and help us spread our campaign. Thank you, Haley.
Thank you so much, Heather. Those videos are excellent. I love being able to share them with the community. Next up, we have an update from Judy Shepard, who's joining us from our pharmacy office for Project 611, Centers of Excellence in Chronic Pain. Go ahead, Judy, sorry.
Thank you, Haley. I don't know how I'm supposed to follow Heather. That was incredible. Like Haley said, I'm with the pharmacy office, and we have a pilot program designed to help bridge gaps in care for HCBS members who live with chronic pain. During an extensive period of time, we received a lot of feedback from various stakeholders kind of expressing how these needs are not being met. There are several challenges in, accessibility, transportation in rural areas of the state, a lack of providers, primary care providers being somewhat uncomfortable with opioid prescribing due to new legislation. So we are hoping to walk alongside providers and members and getting those needs met. So we are partnering with the CU School of Pharmacy. We have a pharmacist and a experienced pain specialist who is offering consults to providers who are working with HCBS members. I am the referral coordinator, and in that role, I'm available to assist with finding local resources, connecting members to their RAIs if they're not already established there, finding behavioral health. Behavioral health and mental health is often side by side with chronic pain. So those are needed services as well. So we're just hoping to get the word out a little bit more as to what we can offer. I do have several referrals pending, which is exciting. We are offering provider education as well, and several of those are scheduled between now and the end of January to help providers feel more comfortable with prescribing and getting them familiar with the program and our consultants.
Thank you so much, Judy. Are there any questions? I wanted to pause really quickly. I realized I didn't pause after Heather's. Any quick questions for Heather or Judy before we move on? All right. Thank you so much, Judy.
I saw a hand raised at one point. I'm not sure if that is still the case.
Thank you, Jen. You're looking in all of the places for me. I do not see a hand raised, but I apologize if I missed you and you were raising your hand. Please just re-raise it, and we will pause again after we have Joe present. Judy, if you can just sort of stick around in case questions come up, that would be great.
Sure will.
Thank
Thanks.
you. All right, next slide, please. All right, we have Joseph Good, who's joined us today to provide a training demo. Joe, I'll hand it over to you.
Thank you, Haley. Hi, my name is Joe Good, and I'm one of the instructional designers attached to the Office of Community Living. And we're the folks working on 304 and 305. And what I'd like to show you today is a little bit of one of the web-based trainings that we've been developing. And this bit will show you an interactive journey that a case manager could potentially go on in order to establish which waiver service the member needs. And I'll go ahead and share my screen just a moment. I guess I'm getting a message that says host disabled participant screen sharing. So
give me 1 second.
Yeah, no worries. And this is, again, a small part of a much larger web-based training, but given time and circumstances, this is what we've chosen to share with you so we can demonstrate the kind of work that we're doing. And I'm just waiting for a word. The snippet I'm going to show you is from one of the web-based trainings we have for HCBS adult waivers. And these trainings go into some detail about the waivers themselves, the nature of the services that are provided under the waivers, how you qualify for the waiver, and the parameters of each waiver in terms of what the actual structure of the waiver is.
Okay, Joe, you should be ready. Thank you for your patience.
Thank you, Max. All right, here we go. All right. So again, this is an interactive element from one of our web-based trainings that walks you through the process of choosing an adult waiver. Hopefully you'll be able to see and hear everything adequately. And I'll just go ahead and start, and I will walk you through this interactive journey here through the series of slides. I'm only going to do one sort of walkthrough, obviously because it's interactive and it asks you to input various kinds of information. There are multiple outcomes, but you'll see what I mean once I begin. And here we go.
Hey, Joe, are we supposed to be hearing something?
Yes, you are. Are you not hearing anything?
We are not. So maybe either if you want to just read what's on the slide, or you want to, I'm not sure if you know
Joe,
how.
there's a way in the 3-dot menu, if you can click on share sound, that might be an option for you.
Let's try this again. Thank you. And just let me know if you're not hearing anything. Okay, sorry about that. The menu is locked in this sample, so I can't replay it, but I will happily read this introductory slide for you. This exercise can help you decide if a home and community-based services waiver might be right for you. This does not take the place of the comprehensive screening process. Answer as though you're seeking help with a specific health challenge. Your answers will not be recorded or shared. Complete as many times as you like with different answers to see how the possibilities change. And it mentions there's a resources tab that will be available so learners can view different documents associated with this concept. So I'm going to go ahead and start our interactive journey through waiver selection.
Institutional care. Do you require care that would typically be provided in an institution, such as a nursing facility, a hospital, or an intermediate care facility for individuals with intellectual disabilities? Choose an answer, then click the Done button.
Okay, so just to review, do you require care that would typically be provided in an institution like a nursing facility, a hospital, or an intermediate care facility for individuals with intellectual disabilities? So we can either answer yes or no. Let's go ahead and answer yes. So our hypothetical member requires care that would be provided in an institution, nursing facility, hospital, etc. So let's go ahead and click yes.
Interview questions. Since your needs put you at risk for being institutionalized, you may qualify for home and community-based services waivers. The following are questions that a case manager might ask to see which waivers might be appropriate for you. Click the OK button to start the interview.
Okay, so now we're going to have a virtual interview to ascertain the nature of our members' needs.
Intellectual or developmental disability. Do you have an intellectual or developmental disability? Choose your answer, then click the Done button.
Okay, so let's go ahead and say that our hypothetical member does have an intellectual or developmental disability. Click yes, click done.
Intellectual or developmental disability waivers. How much support do you need for your intellectual or developmental disability? Choose an answer, then click the Waivers button. Answer choices. I need support 24 hours a day. Or, I can live independently, or without the need of 24-hour support.
Okay, let's go ahead and select I can live independently or without the need of 24-hour support.
You chose the answer, I can live independently, or without the need of 24-hour support. Based on your answers so far, you may qualify for the Supported Living Services waiver. You might also qualify for the Elderly Blind and Disabled waiver. Click the OK button when you're ready to continue.
Okay, so our hypothetical member has an IDD, an intellectual or developmental disability, but they can live independently without the need of continual 24-hour support. So far, our module has winnowed the selection down to 2 possible waivers that might be appropriate for our hypothetical member: Supported Living Services and the Elderly Blind and Disabled waiver. So let's click OK.
You can learn about the waiver possibilities for the other option by selecting it and clicking the Waivers button. And remember, even if you qualify for more than one waiver, you can only receive services under one waiver at a time. If you have conditions in addition to your intellectual or developmental disability, click the Other Conditions button. If you want to return to the beginning of the exercise, click the Start Over button. If you want to end this exercise, simply close this browser window.
So from here, we could branch out into another hypothetical scenario for somebody who needs 24 hours a day. We could start over, or we could view other conditions. I'll go ahead and click Other Conditions.
Medically related waivers. Do you have a physical disability and/or a diagnosis of a major mental illness? Choose an answer, then click the Done button.
So our hypothetical member will have a physical disability or a diagnosis of major mental illness. Let's click Yes.
Brain injury. Do you have a brain injury? Choose an answer, then click the Done button.
And let's say that you don't have a brain injury, that this is a developmental disability. So click No and click Done.
Other conditions. Do you have any of these conditions? Choose all answers that apply to your situation, then click the Waivers button. Answer choices. I have a spinal cord injury, multiple sclerosis, spina bifida, muscular dystrophy, or cerebral palsy, and need a mobility aid or support to walk. And/or I have a major mental illness diagnosis. And/or I am blind, physically disabled, or have a diagnosis of HIV/AIDS. Or I have none of these conditions.
Let's go ahead and click on this. I am blind, physically disabled, or have an HIV/AIDS diagnosis. This is probably going to route us to the EBD waiver. Let's see what it says. There you go.
You chose the answer, I am blind, physically disabled, or have a diagnosis of HIV/AIDS. Based on this answer, you may qualify for the Elderly Blind and Disabled waiver. Click the OK button when you're ready to continue. To learn about the waiver possibilities for the other choices, select all the conditions that apply, then click the Waivers button. And remember, even if you qualify for more than one waiver, you can only receive services under one waiver at a time. If you want to return to the beginning of the exercise, click the Start Over button. If you want to end this exercise, simply close this browser window.
So that's really what we've come up with in terms of, I'm going to stop sharing my screen, in terms of creating some interactive content that will help members establish which waiver service is most appropriate for them with the guidance of a case manager. And that concludes my demonstration. Thank you for your attention.
Thank you so much, Joe. I have to admit, I hadn't seen that yet. It is very cool, and I can see how it will be incredibly helpful for members as they're trying to navigate. Going back to Tasia's earlier presentation, the system can be really confusing, and there's, all these different waivers, and it's really tough to understand all of it. So trying to identify tools and resources that are easy to use is really the way to go. So we're so excited about that new training. Thank you for showing it to us. So before we move on, I want to pause again and see if there are any questions. I think our next slide is our question slide. Any questions for Heather or Judy or Joe about what they have covered today in terms of some of these key project updates? Again, reminder, you can put your question in the Q&A box. You can raise your hand. You do so under the Reactions tab at the bottom, or you can press *9 if you're on the phone to raise your hand, and then *6 to unmute. Okay, not seeing any. I will keep us moving. Thank you again, everybody, for presenting today. Next slide. So in this next section, we are going to, again, mention our grant opportunities. We want to be sure that the community knows about what is currently open and available and what is upcoming. So if none of these fit maybe your organization, we really do request that you share these with your network. We want to make sure that the word gets out about these opportunities. As I mentioned earlier, we're closing in on our end date here, and want every organization, provider, and member to leverage this once-in-a-lifetime opportunity with these funds. So first up, we are going to have Heather back again to talk a little bit about the training grants. This is project 1.05.
If you haven't heard me talk about training grants, I don't think you've heard me. We are really, really, really happy to have the opportunity to award up to $100,000 per grant to HCBS providers or to a vendor to deliver the training to HCBS providers. All about higher level skills. The goal behind this is, oftentimes we can't really put a lot of investment in those retention and that staff development because we're worried about the day-to-day and turnover and recruitment. And so we really want to have this opportunity for folks to create those training opportunities to further develop their workforce. You can get pretty creative with what higher level learning means to you. You're just going to have to tie it to what that benefit is to the direct care staff, what that benefit is to the members, and what those outcomes are. We have awarded probably about 50 grants so far, and out of our provider grants, and we have a grant cycle that is closing the end of this month. So if you have an idea and you want to get it going, you have about 14 more days to get that application in. Would like to let you know we have 4 cycles left. So if you're not quite ready yet, we'll have another cycle that'll open December 1st and it closes the end of January. All that being said, you have to be able to spend all of the funds by August 30th, 2024. So time is short, but there are probably some training opportunities out there for you that you might be able to take advantage of. We will have an informational webinar on December 4th, which if you can come, you can ask questions. We'll give a short little presentation about the application process, and you can come ask questions there. We can kind of do some troubleshooting for you. And we do have some links there for the request for application and how to apply. And if you go to the next slide, you could see some ideas here on our website. We have all our grant recipients, our awardees on there. And so there's just some on here because of space, but you can see the ideas that other folks have had. You can see where those awards are going. I think it's important to note that you do not have to request $100,000. If you have a $5,000 training request that we want to support with this, great. We will consider all amounts up to $100,000. I think another key piece to offer is you can include the wages for the staff to attend that training in that grant request. Because we also know you could have a great idea with the training, but you don't have the opportunity to fund your staff to take that training. So those can be included. And again, if you have questions, please come talk to us. We've awarded $3 million and we have another $3 million to award. So we'd love to get that out the door. I did pull some data I wanted to highlight. We have, through these training grants, trained as of the end of September, 1,838 trainings have been completed. And we've had some certifications out of that. We've been tracking a few of those. We've had 36 registered behavior technicians trained out of this. And we've had 36 CNA nursing assistants trained out of this so far. And there are more in the works. That's just some data that we already had. So please visit the site, email us if you have any questions. And we really encourage you to share this opportunity before it ends. My last little plug is we do have grants for direct care workers themselves that they can apply for. It's up to $500. You'll find that also on the website. So if you have staff or folks who might be looking to do some of their own staff development, please encourage them to apply. It also covers folks wanting to enter the direct care work with some ideas with that. So please check out our website, shoot us questions, and come to our informational webinar if you want to get your questions asked. We would love to have you apply soon. Thank you.
Thank you so much, Heather. We're just going to keep having you back in every quarterly webinar until we can get all of this funding spent. We want to give people opportunities to get trained and to create new high quality training. So it's so important. All right, next up to talk about a grant program, we have Michelle Craig, and this is an exciting brand new one that I don't think many people have heard about yet. So Michelle, I will turn it over to you.
Great, thank you. Good afternoon, everyone. I'm Michelle Craig. I'm the Complex and Supportive Services Section Manager here at Healthcare Policy and Financing. I am excited to talk with you about an exciting new concept we have for a grant. The idea, and I should first say this is not posted yet. We're still in the process of clearing this and hope to have the request for application out in the next several weeks. And then we will also have a question and answer webinar. We'll send the date out once we post the request for applications as well. But the purpose of this grant is trying to think about serving people who have maybe more high acuity or complex behavioral health or medical support needs in more creative ways. We have many mechanisms in place already to pay higher levels for residential services and things like that. But I got to thinking about, are there other creative ways we could explore to help, in particular, residential environments be more accessible, welcoming, being a good place for people to live, because we all know where you live is very important, and having that be a safe, secure place that you like to live in and want to be in really can contribute a lot to someone's mental health wellness. So what we're looking at for this grant is that agencies could apply to receive grant funds to purchase things to enhance residential living environments for individuals. These would be residential environments that are provider owned or rented. They would not be the purchase of a home or things like that. But we're thinking this could be things like specialized equipment not otherwise covered by Medicaid. With that, this wouldn't be a specific purchase for a person, but it would really be a purchase for that residential home. Could be, I've thought of things like the purchase of sensory equipment to build a sensory den or something like that. Given a lot of thought to things like trauma-informed environments. So maybe things like engaging a consultant to make recommendations for environmental, either safety improvements or changes to the residential environment to make it more trauma-informed, safe, comforting place for people, and really open to some other creative solutions or other creative options to transform residential environments into these welcoming places that could help enhance a provider's ability to support an individual in that residential environment. So like I said, we don't have this posted yet, but we're working on getting it out soon, expected to open that up in December. We're working on a shorter time frame with this one, as this is a kind of one of our last new grants to come out. Our plan is to be awarding the grants, I believe hopefully by February. I may have my dates off just a little bit, but my point is we're intending to move quickly on it because we have to have all the funds spent by September 2024. So we're going to prioritize the applications as they come in, prioritize the reviews, and do sort of a rolling approval on that so that we get moving on any awarded grants. So we'll send this out in our ARPA newsletters. If people have questions, you could reach out to me. We'll post it on our ARPA grant site. So more to come. And I don't know, Haley, if there's any questions folks have or.
Yeah, thanks, Michelle. That was great. This is so exciting to have this new grant being offered. We have one more grant program to go over. So if you can just hang around, Michelle, in case any questions come up. I'm going to hand it over to Max, and he's going to talk about 7.02.
Yeah, thanks, Haley. Hi, everybody. I'm Max Flinkler. I am the Strategic Unit Supervisor, and I am one of the project leads on the 7.02 emergency preparedness projects. This encompasses several different initiatives. We're calling it Surviving in Place, in partnership with the University of Colorado Denver's Center for Integrated Design, Inclusive Design and Engineering, formerly known as AT Partners, for those of you who have been in the Colorado disability world for a while. And what these programs are offering are opportunities for Medicaid members who have needs that might become perilous in the event of an emergency. So the two primary opportunities for members are a battery backup power system, as well as emergency go kits. So the battery backup power supply systems are really neat, state-of-the-art systems that are battery powered generators, essentially. They are able to be used in power outage emergencies. So this could be due to a wildfire. It could be due to high winds that take out the power grid in our southern parts of the state. And they're really just a really good kind of backup plan for individuals who use life-sustaining medical devices. Now, life-sustaining medical devices encompasses a broad array of different things. It could be things like dialysis machines, ceiling lifts, nebulizers, even something like a refrigerator that's used to keep medications at their proper temperature that an individual needs. So we're really trying to encourage as many people as possible to apply for this great opportunity. These are really fancy devices. They have quite a high value, so we want to make sure that people are aware of it and taking advantage. That's an image of one over on the right. So I have some links on the screen here that you can access in the slide deck. I'll also grab a link that goes to the main page for this program and drop it into the chat. The second is our emergency go kits. So these are essential items that are specific to needs that an individual with a disability might have that they can quickly grab and take with them in an emergency for an evacuation. So this has a long list of basics that are available on the website, things like first aid kits, dry erase boards, N95 masks, flashlights, water bottles, ponchos, pretty standard emergency supplies. But then there are also some really customized things based on your disability. If you have a mobility disability, for example, and have a service dog, there's a dog bowl. If you have hearing issues, there are earplugs, there are dry erase boards. There are signature guides for individuals with a vision impairment. So a process that's very individualized and something that the University of Colorado is doing on a person-by-person basis. So please let all of your clients or friends or family members know that these two programs are available. They are going to be open until we run out of supplies. So please do apply as soon as you can. All right, I think we will pause for some questions now.
Yeah, thanks, Max. So there has been a couple questions come in. Ken Wynn, I see that you had a question for Michelle. Do you want to come off mute and ask your question? Or Jen, you may have to do that. It's Ken Wynn, if you can unmute Ken.
Go ahead, Ken, you should be able to talk.
Yeah, I know it's dangerous to let me speak, but thank you so much. Yeah, just the question, I put it in the chat a little bit too. So Michelle, first of all, just want to comment, it's amazing and fantastic that there's a grant for individuals with complex behavioral and medical needs. So kudos for that. That's awesome. You seem to mention mostly physical plant and equipment stuff. I just wondered if the grant will go beyond some of that in terms of additional clinical supports, trainings, things of that nature. Is it mostly going to be about physical plant and equipment kind of stuff?
Got myself confused. I'm clicking lots of buttons. Now I'm unmuted. Yes, Ken, great question. Yes, it can go beyond stuff. So the physical environment is a piece to it, but there also could be some training components. Again, similar to Heather's grant program, it wouldn't supplant any trainings that are already expected to be covered by a provider through waiver services. But if it was sort of above and beyond, one example that I can think of is maybe supporting people with Prader-Willi. So if an agency wanted to really enhance their services for people with Prader-Willi, we do have a recorded training that really, it's a good training, but it sort of skims the surface. So if an agency wanted to engage with a trainer or a consultant to really come in and provide some in-depth training on that, looking at making recommendations for agency policies and procedures and environmental changes to better serve individuals with those needs, we would look at things like that for this grant.
Great, thank you.
Thank you.
Thanks, Michelle. Appreciate it. All right, I don't see any open questions at the moment, but I will pause and see if any come in. Again, you're welcome to type your question, or like Ken did, you can come off mute and ask it. If you raise your hand, we're able to know that you want to come off mute. Okay, not seeing any. We can move on to the next slide. I'm actually going to pass it back to Max.
Great, thanks, Haley. So we are at the end of our webinar, and just wanted to thank you all for attending and finish up with some reminders. We have our ARPA Project Pulse newsletter that comes out monthly approximately. It provides similar updates to all of these, as well as ones that we don't do in the webinar. So another way to stay tapped into everything that we're doing. I'll drop a link for the website for those past issues and how you can subscribe in the chat. So please check that out. We also have our standard 60-second satisfaction survey, as we like to say. So Jen, if you can advance, that would be great. We use this survey to inform our planning for these webinars, as well as for reporting to the JBC and the CMS folks at the federal level. So we always appreciate your feedback and do read every response. So please let us know how we're doing there. And then finally, just an update on our next quarterly webinar. It will be taking place on Thursday, February 15th. Same time, and there is a link in the chat to register for that if you are interested. That will allow you to get it on your calendar, as well as get reminders about it. So once again, thank you all for attending, and let us know if you have questions via the website. Thank you.